Happy Saturday. So today we're doing a paniculectomy. A lot of people have difficulty pronouncing paniculectomy. Basically, a paniculectomy is removing the pannus. So what is the pannus? A pannus can be a variety of areas throughout the body, but typically it's the abdomen. It's the lower abdominal wall which goes over the pubic region and sometimes then can extend down onto the anterior thighs, whereas on this patient it actually goes even down to the knees. So let's go, I'll show you how we do it. So today we have a patient who has developed this abdominal pannus about 37 years ago. So this is basically called a pannus, and it basically goes down past her knees. She has difficulties ambulating, difficulties exercising, difficulties keeping the area clean. So what we're going to be doing today is called a paniculectomy. It's not an abdominoplasty, it's not a tummy tuck. We're basically getting rid of the excess skin and fat here to make her function much better, her activities of daily living much better. So let's go to the operating room and I'll show you how we do a paniculectomy, basically from hip to get rid of a very large abdominal pannus. For this one, we're going to do sort of like a reverse tummy tuck. I'm going to make my incision on the upper side, on the cephalad or the top side of it, and dissect down. I know where to go because I got my handy dandy towel clamps here where I can feel directly where the flap is so we can get it reapproximated. So something like that, okay?
Took my life from negative to positive, I just want y'all to know that. And tonight, let's enjoy life. Pitbull, Naya, Neo, Tesla.
My central third here is the middle third of the abdomen, dissected down to the anti-abdominal wall, and then coming underneath this pannus. Now I'm going to do the lateral third here, and then come underneath this thing and approach it from the lateral side. So now we're just going to do our laterals here. So it's going well. We did our dissection, at least on this side, and now I'm using my towel clamps to measure how much we can remove here, and I'm feeling the tension on the skin flaps to make sure it's not too tight, not too loose, just right. And so I think this landmark's going to be pretty good, and then we can get this back together. So this is our anticipated resection line now here. We're going to come in through something like that. Done with our paniculectomy. Again, a paniculectomy is getting rid of a pannus. What is a pannus? A pannus is any area of skin and fat that grows outside its borders. Typically it's on the abdomen. This is an abdominal pannus which extended from the lower abdomen, covered the pubic region, covered the anterior portion of her legs, and actually covered her knees. Always got in the way. She couldn't exercise. She couldn't ambulate. It was a very, very stubborn area. She had lost a lot of weight, but she still couldn't get rid of it. So we did a paniculectomy here, getting rid of this abdominal pannus. So we're done. We did a 30-pound paniculectomy. This is the pannus we removed from the patient's lower abdomen. And the procedure we did is a paniculectomy. So we removed all that, 30 pounds. So now she can ambulate better, she can walk better, she can get out of bed, keep this area clean, exercise. You can imagine instantly taking 30 pounds off your lower back, your abdomen, your hips, your knees, your ankles. So she's going to feel wonderful. So paniculectomy, if you have a pannus, lose the weight as much as you can first, and then you may be a qualified patient for a paniculectomy. So if you have a pannus or know somebody that has a pannus, give me a call. So thanks for watching. Please subscribe. We'll see you next time.